Thoughtful Connections, a memory care podcast, aims to provide general information and insights about dementia and related topics. The content shared is not intended to be medical advice or a substitute for professional medical or clinical guidance. The purpose or goal of this podcast series is to help inform and educate family members considering memory care for a loved one. With us, as always, is Elizabeth Thompson, Arrow Senior Living Regional Director of Memory Care. Hello, Elizabeth. It is a pleasure to be with you once again.
Is it really?
Okay, I stretched it a little bit, but hello anyway. Well, today's topic, it's a sensitive one that's often overlooked.
Yes.
So we're going to discuss abuse and neglect in dementia care.
Thank you, Charlie. It's good to be here with you, too.
Thank you.
Yes.
Thank you.
This is a tough conversation, but it is absolutely one that we need to have.
Mm-hmm. So let's start by defining what we mean when we talk about abuse and neglect, as mentioned in dementia care.
Absolutely. Abuse can be physical, emotional, sexual, financial. Neglect can be intentional or unintentional, like just failing to provide basic needs, such as food or hygiene, incontinence care, medical care. People living with dementia are especially vulnerable because they aren't always able to advocate for themselves.
Mm-hmm.
Well,
just a thought of any of those are heartbreaking, but I imagine it's also not easy to detect sometimes.
Correct. The signs can be very subtle, unexplained bruises, which is hard because as we age, we bruise easily.
Mm-hmm.
Withdrawal, fearfulness, or even sudden changes in behavior. Sometimes what looks like a symptom of dementia may actually be a response to being mistreated.
My goodness, okay. So what are some of the risk factors that increase the likelihood of abuse or neglect?
So for me personally, I see this more in not assisted livings and homes, but more so in private family home situations. But there are several. Lack of education or knowledge of the disease process. Caregiver stress is huge. We also social isolation plays a role. But sadly, abuse can happen in both places, at the home and in institutional settings. It's not always malicious. I think that sometimes it's just a result of that extreme burnout and exhaustion, lack of support. There are a couple of videos that just kind of shed a little light on not so much abuse and neglect, but just the emotional toll of family members. And they're very short. One is a short film called The Wait. Another one is called Ruth. And then the other one is called The Fragile Storm. These are all like under 15-minute videos that show the perspective from the person living with dementia and what it's like for them, but also for the caregiver. And, in an institutional type setting, you've got caregivers that are rotating throughout the day on shifts. But for someone who is caring for someone at home, that's a 24/7, 365, never-ending caregiving role. And that's just, it's too much. Mm-hmm. It's not sustainable at all.
Well, sure, even no matter how well-meaning these caregivers are, I mean, they can find themselves overwhelmed.
Oh, easily.
Mm-hmm. So, can you maybe share some support and education and oversight and tell us why it's so important?
Yeah, I think support and education, oversight. We need to be caring for the caregivers too. I do have some key findings on abuse and neglect by family dementia caregivers. There's a high rate of self-reported abuse and neglect. According to 2023 National Care Center on Elder Abuse research brief in a study over 21 days. 21 days, that's all, not even a full month. 74% of family caregivers of people living with dementia reported at least one day in that 21 days where they engaged in abuse or neglect. That's huge. This is not something that's going away. We are seeing more and more people with dementia. We've got to start providing better care for these caregivers, whether or not it may be that they can't afford to place their person living with dementia. But that doesn't mean that we don't just leave them to fend for themselves. We've got to have better support systems. A daily diary type study found that if a caregiver, this is just blows me away. If a caregiver had meaningful non-care interactions with their person with dementia twice a day, they were 20% less likely to engage in abuse and neglect that day. So having meaningful interactions with your person living with dementia, which is what we try so hard to help caregivers have, that's going to lower your risk 20%. Mm-hmm. Just by having a couple of meaningful interactions that day.
Just being able to make connections with your individual.
Yes. So I think that's huge. But being able to, provide these coping skills and social support and stability, it's so important. There was another more recent study, a cross-sectional study of family dementia caregivers identified being a spouse as a major risk factor for both psychological and physical abuse. I think that would be extremely hard to be the spouse of someone because you're so used to seeing them a certain way, and now they're no longer that same person. They're still there, but they're different. And you go from being a best friend to almost like a parent for your spouse. That's got to be very hard. And the studies show that there is a major risk factor for spouses who are caregivers. And, so many times we see the caregivers pass before the person they're caring for just because of stress.
And they simply don't take care of themselves.
Yeah. But in all honesty, it's hard. Mm-hmm. How do you
they don't have time to take care of themselves, or don't take time,
right,
or don't make time to take care of themselves.
So start with education. It's important that that we know the signs, ask questions. If your person is living in a community, visit at different times, build relationships with the staff and the community. If you're a caregiver, don't be afraid to ask for help. There's respite care, support groups, and training can all make a huge difference, but we have to be bold in asking for help. And we also, if we know someone who's in that situation, we need to just help.
Just offer.
Don't
ask, what can I do to help you?
Yeah,
because
just
99% of the time they say, oh, I've got this under control. Everything's fine. I've got this, because if you know what the situation is as an outsider, just go in and help. Just say, hey, I'm coming over this afternoon, plan to be gone for a couple of hours. I'm going to plan to be there between 2 and 4. You make some plans to do whatever you want.
Yeah. Or take a nap.
Yeah, yeah,
You know?
yeah. You come to my house and take a nap.
Yeah.
And just get away from the situation.
Or make a meal, or,
Sure, whatever you want to do. But
right.
Definitely, don't ask. Just do.
Yes. And that's for the person who is not the caregiver. That's for, you and I and everybody else out there who's not being a caregiver at that time, helping those who are caregivers. And for the caregivers, just making sure they are asking for help. There are so many people that would love to help, but just don't know how sometimes. And so ask for help. That's what we were created to help each other. We are created to help and support each other. And we've got to start doing a better job at that.
And, what came to mind as we're having this discussion, there are also, I'm sure, a group of individuals that have been past caregivers to individuals with dementia.
Oh, yeah.
And their folks have passed that have this inherent knowledge, that of taking care of people with dementia. Wouldn't they be a great resource to step in from time to time to help, individuals,
sure.
as a respite? I don't know if there's an organization that of those individuals. I don't know if that's such a thing or not, but I would think those would be perfect individuals to step in as a respite, to help folks or not.
I think that would be a great idea. Senior age, different resources you can look out there to see what is available. I know there are a lot of day programs. I'm seeing more and more of those come to open. I know Florida has quite a few, but that respite, just that break is so necessary.
Now, I'm going to back up just a minute. Now, taking your individual into a new environment, like the day programs you were talking about, would that not be upsetting to the individual to go into a new environment like that or not?
Kind of just depends. I mean, the only thing that you can do is try. You never know until you try. And maybe you're just going for an hour with them. Sometimes we'll have people who are touring our communities just come and have lunch with us, spend a day, see how it goes, with their caregiver present, just to kind of see how things go. And then maybe come back another day and try without them present. But you don't know until you try. And for many people who are living in a home situation with family caregivers, they're very bored. No fault of the caregiver. It's just hard to develop a routine when you're managing so many different things. You're managing a household as well as trying to care for this person. And so sometimes we see when they come from a home situation to moving into one of our memory care neighborhoods, or, trying a day program or respite program, they actually enjoy it because they're getting to socialize and they're getting to be busy and engaged with different engagement opportunities throughout the day.
Instead of sitting in front of the television.
Exactly. Instead of sitting in front of the television. And that's what I always find so funny is so many families, I cannot even tell you how many families have said, oh, my mom or dad or brother or sister or husband or wife will not participate in activities. Okay.
It's because they haven't had the opportunity.
They haven't had the opportunity, yeah.
Because they wasn't provided to them.
Right. And then all of a sudden we've got someone who is fully active in the neighborhood, who's, the neighborhood plant operations director or whatever. He's tinkering with, things on the workbench. And we've got the, lady that's wanting to fold all the napkins for the silverware, to roll all the silverware. And, they need that.
Or become involved in art projects. And all these various events y'all have scheduled events every day.
We do.
Music and art and just all these things, exercise. I mean, it's like, things that likely weren't being offered, to them,
Yeah.
in a home setting, So,
Right.
so I can certainly understand how that would be such an improvement,
Mm-hmm.
for their lives,
Yeah.
But you also, I think you made a very good point earlier, is that a lot of people can't afford
Mm-hmm.
memory care.
Right.
And I think that that's a huge issue because memory care is not cheap.
No,
It is not cheap,
it's not.
to pay, for your loved one, to live in memory care. It simply is not.
Yeah. Yeah. And I think there are so many people. I know I was on I helped a friend who has a nonprofit, and I was on a call with her one time, and there was a family member that literally both her parents were diagnosed with dementia. She had to quit her job and move states to come and take care of them. And it's like, how do you even make money while you're trying to care for them? I mean, you're basically now living on their Social Security,
Hmm.
trying to feed them, clothe them, care for them, because it's impossible for you to work.
Hmm. Issues had to exist on them running as well.
Yeah,
Yeah, yeah, a tough situation.
very tough. And she's, my heart just went out to her because she was clueless. She's like, they have this, but I know nothing about it. I don't even know what this means or where we're going, where we're headed.
It sounded like if she was on the call, she was at least starting to try to educate herself
Exactly.
and reaching out, looking for information.
And that's huge.
Uh-huh.
That's the biggest thing, is that we've got to educate ourselves.
Mhm, mhm. So, what about if an individual suspects a problem with abuse and neglect? Talk about how do you go about reporting that?
So I always say, because our company says this, see something, say something. If you suspect abuse, report it immediately to Adult Protective Services, to a community administrator, or even law enforcement. It's better to be wrong than to stay silent. We have to speak up. We have to speak up. And like I said, if we're wrong, great. But if we're silent, something really bad could happen
Mm-hmm.
to either caregiver or the person living with dementia. I mean, if someone is living with dementia and not getting the appropriate care that they need, whether it's neurological medications or behavior modifications, and even speech, physical, and occupational therapy, they could maybe even be very hard to control and be abusive to the caregiver. So it goes both ways. But if you see something, say something.
Mm-hmm. Good advice. So, how do we create a culture where abuse and neglect are less likely to happen?
Just realizing how hard caregiving is. I think until you do it, you don't realize how hard it can be. But caregivers have to have a break. It starts with respect too. When we see people with dementia as whole, valuable individuals, not just residents or patients, we're going to take better care of them. We treat them differently. We also need to invest more in training for family members, supporting caregivers, holding systems accountable. Compassion isn't just a feeling, it's a practice. We need more churches and communities and senior centers to be more involved with a focus on dementia, because like I said, this isn't going away. I've even had trainings with staff before where there may be 20 employees in a conference room, and I'm like, okay, 3 out of 5 of you are going to have dementia. So let's take this row. 3 out of 5 of you are going to have dementia. It's not going away. we've just got to be better at caring for our caregivers.
Mm-hmm. Very, very well said. So it's really about building a system that protects everyone involved.
Yes,
Not,
Yeah.
Not just the individual, but the caregiver as well, and truly the community. It's a community effort, isn't it?
It is, and that's safety, dignity. It should never be optional. We all deserve that, and we talked on the panel the other day with our podcast with the Cottey College group just about how we treat our seniors today is a reflection of how we are as a society.
Mm-hmm.
We've got to be better.
Absolutely.
Because we're all going to get old. I didn't think I would, and here I am. It's happening.
Well, I sure as hell didn't think I'd ever be this old. Elizabeth, any final thoughts on abuse and neglect?
I would just like to also put a plug out there for Sandy McGatha, our clinical social worker. She has a virtual support group that takes place every single week, and it's free. So look at arrowseniorliving.com, or maybe we can even put the QR code or a link to Sandy's support group with this podcast. But she is very helpful. It's free. There's also support groups through the Alzheimer's Association, Lewy Body Association or organization, Parkinson's. They all have different support groups. But get the support that you need. And I hope this inspires people to speak up, to reach out, and to care more deeply.
Well, thank you. Thank you. And it's been a tough conversation. I know we normally joke around and carry on, but this was a tough one that needed to happen. And I hope it's beneficial to many folks listening and watching.
Me too. I hope it encourages people to step up and help.
Thank you again. And thank you all for sharing your time with us. At Arrow Senior Living, we believe in the power of a chuckle, maintaining a childlike sense of wonder, and defending the dignity of others. Until next time, this is Charlie Johnson with Arrow's Thoughtful Connections, a memory care podcast, wishing you fond memories filled with moments of joy. And remember, if you've met one person with dementia, you've met one person with dementia.
You can find Thoughtful Connections, a memory care podcast, anywhere you listen to podcasts.